Recently I've been having some low back pain. All right, so and also the fact that looking at your videos and looking at some of the brochures that were there, the one thing that stand out is you had about infertility, and the thing is that I've seen the urologist, and I was diagnosed with the fact that they weren't able to see any sperms when they did your semen analysis.
Right. So we talked about it before. So
yes.
You mentioned there's absolutely
Zero. Yes.
Got it. Okay.
So coming here today hoping that we'll try a different alternative, because I've done the medications and everything, and to this point no results. So
got it. All right. So let's take a look. So here's the deal. I understand you came in for low back pain and the infertility. Okay.
yes.
Now we're going to connect the dots how everything is all connected with the nerve system. Okay. So the vital thing is we want to make sure your pelvic foundation is stable and level. Okay. It's no different from a house foundation. Okay. So if your house foundation is stable, your structure is going to be stable. If it's unstable, your structure is going to be unstable. Okay. So this region over here, okay, you want to take a closer look at, because clearly when you did your track, when you were running track many years ago, you felt something popped out. Okay, that was the instigating point at that time. It caused the destabilization of your pelvic foundation. Now, what's even more interesting and vital, okay, on the X-ray that we need to evaluate is this one region right over here. Okay, so you typically, when you tell us that there's absolutely zero sperm, okay, that tells us the nerves that are connected to your testicles typically are at the first and second lumbar vertebrae nerves. Okay, meaning this fellow over here, you're going to travel all the way straight down to the testicles. Okay, so if there is a structural abnormality over there and it's causing the nerves to be compressed, okay, and obstructed, how do we expect the germ cells in the testicles to create those sperms? You can't. Okay? So we're going to take a closer look in your structure, see if you actually have this problem. If we do correct it and remove the obstruction to your nerves, just want to let you know, it takes a bare minimum of 3 months for the germ cells in your testicles to start producing sperm. Okay? So we're gonna definitely do a follow-up 3 months down the road, see how you're doing. Okay. So as we discussed before, okay, the pelvic foundation, this one over here, pelvis went forward and inwards. So that's what caused that tunnel to collapse a bit. Okay. But before we could address that part, what I see is we need to address first, in your sacral foundation, okay, you had a rudimentary sacral disc over here. We need to correct this first. Okay. That's why you're experiencing that pain and discomfort on the left side, because of the way the segment rotated towards this way, putting a lot of pressure on this side. So we do need to correct this one first, and then we'll address this, okay, in the future. In addition to, that's what I also see over here, the second lumbar, okay, this disc over here, it's kind of puppy, okay, and this also went backwards. And the way it's misaligned on here, okay, it went more towards the left. And in addition to, see on the disc over here, right, it's more increased on the right side versus the left. So in other words, it's wedged this way. Okay. So because it's wedged this way, that's the one we need to take a closer look, see if we need to correct. Okay, starting with stand-up a patient, we're looking for signs of swelling, edema or muscle spasms, and we see one right over here. Okay, that looks like the 6 dorsal bones. 4, 5, 6. Where's the 6 dorsal? See that little speed bump over here?
Yeah.
Right? That looks like that's your second. 4, 3, 2. Yep.
All right there.
Hurts right there, right? That's number 2, the second lumbar. And you also have quite a bit of swelling on the left side over here.
Yeah, not too much on the left, I'm sorry, on the right, but quite a bit right here on the left side. So now I'm going to check with motion palpation, check for any abnormal movement. Your hip swings both ways. But this second sacral segment right over here is jammed on this side over here, while the rest of your sacrum pivots and moves fine. The right hip somewhat fixated. But I figured this, correcting the second sacral segment in the future is going to show the right hip that we need to correct in the future. There it is. Tell me right there. Right here. More here, huh? Tender?
Yeah.
I said that. This is what we need to correct. Okay. A little more. Drop the belly. A little more. Keep on dropping. Just drop right there. Just drop it. Good. There we go. Drop it one more. Just gotta let this sink in a little more, okay? A little more. We can see how big the swelling is right here, just for the second sacral segment. Drop the belly even more. Keep on dropping. There. A little more.
Yeah, before I couldn't touch my toes.
Mm-hmm.
Now I can actually touch them.
You can touch your toes, huh?
Yes. Yes, because bending before, if I bend over, I can never keep the left knee straight. It's always a slight bending with the knee going down.
Mm-hmm.
But now I can actually keep the knee back straight and actually go touch my toe.
All right, that's great. Okay. So now we structurally corrected that. Okay. In a follow-up visit, we're going to see how your right hip is doing.
Okay.
And we're also going to keep an eye on the third lumbar.
Okay.
And I would recommend a follow-up with your urologist 6 months down the road.
Okay.
See how, if there's any sperm, it's being produced or not. Okay.
Okay.
Any other questions?
No.
All right, we're all set. Oh, you're welcome.
Thank you.